About 12 years ago, my hospital came to me and asked if I would be interested in helping them open a wound center. I'm a vascular surgeon by training and had been doing vascular surgery for about 20 years. I realized that we had a lot of wound care patients in our practice, and so I felt that that would be a good opportunity to be able to help them a little bit better. I thought we were doing a pretty good job either way, but once the hospital encouraged me to do that, we went into doing wound care, and I learned that I knew nothing about wound care. And over the next few years, I learned as much as I possibly could. I studied, I hung out with the guys, a lot of whom you will see at the SAWC, and learned as much as I could about wound care. And then we proceeded to go from there to continue our learning process so that we could help our patients. But that's how I got into wound care, and I've been doing it now full time for 12 years. Well, just being able to come and to visit with friends and acquaintances and catch up with everybody and see what everybody is doing as far as their work in wound care. We learn a lot just by visiting with each other. Obviously, I go to some lectures as much as I can, but it's really fun to get together with all the people who are doing wound care full time and to try to see where we're going and where we need to go to improve our wound care for our patients. When we find new information, we obviously do our best to spread it around to everybody that we feel should need to know that. I'm fortunate enough to be able to teach different wound courses, and I speak a lot for wound care. And as a result of that, I try to include all of that in with the presentations that I do, so that over a period of time we have been able to get the message out. Whether or not people take it to heart and actually use it is another issue. But for the most part, the new things that we learn that are useful to patients, that are available to the people who are doing wound care full time, then we try to distribute that information in a number of ways, including face-to-face discussions and lectures and the other ways that we can as we travel around. Our wound care center is a little bit unique in that we are a full-time wound care center. We have 3 full-time physicians who do nothing but wound care in the wound center. We're not affiliated with any of the national companies, so we are pretty much a freestanding wound center that I started 12 years ago. We have a staff of about 13 nurses who work with us full time, and I love to bring them to the SAWC for a number of reasons, one of which is it gives us an excuse to do posters and everything to help them learn more about it and about what we're doing and how to present that information. But just as importantly, they get to come to the SAWC, they get to listen to all the people that I talk about, they get to meet them and really realize that these are real people, I just didn't make them up. And as they listen to people talk, they realize that our wound center is at the cutting edge of wound care. We're doing the most important part of wound care. We're doing the most up-to-date wound care that we possibly can. And it's a sense of pride for them to realize that they are right on the cutting edge of providing the best wound care that we possibly can for our patients. That's a tough question. Obviously we do. All of us who are in wound care, we've learned from each other. I mentioned to you that I was a vascular surgeon by training, and I thought at one time I knew a lot about wounds. But when we began to look into it and we got into doing it full time and I got to seeing what actually was out there, I realized that first of all, when I started, I didn't know that much about it, really. There was a lot of information that was missing out there. We didn't have a lot of books. There were very few wound care journals at that time. I was very fortunate to be able to align myself with several of the giants of wound care. Dr. Robert Kirzner was one that helped me a lot, as were others. They kind of took me under their wing as we were doing clinical trials and things along those lines. And I was able to really move into the wound care group, if you will, and to learn a lot as we have progressed. We now have books that are available. We have online programs where you can learn. We've got journals and all of those things, but none of those were available at the time. So we had to turn to each other and learn from each other. That was how pretty much I learned. Historically, it was very easy. I would just talk to the representative or the person at the wound care office there, and we would just ask for samples. We would take them home, we would use them. And if we liked it, we would continue to order them. As everybody knows now, it's getting more and more difficult to do that because a lot of our hospitals and wound centers are having formularies and they're fussing about ordering new products because they're expensive, all of that. So getting a new product into a wound center is somewhat difficult now, certainly not as easy as it used to be. But what we will do, we obviously will do our due diligence. We see new products, we learn as much as we can about them. We look to see if they're better than what we're using, or if they provide another avenue that we're not able to get through another type of product. And if so, then we'll go through the administrative hassle that it takes to get a new wound care product brought into our wound center and to use it. That's been very, very interesting to me. One of the things that I was very surprised to see as I look at it, I jokingly tell people that about half of the wound care products we use in our wound center today didn't exist 5 years ago. And a lot of the times that's true. Obviously, in the last 10 years, we've had the advent of tissue engineered skin, negative pressure wound therapy, and of a lot of the more advanced wound care products that are out there. I feel that we're kind of lacking at this point. We need another big step forward in what's available for wound care. We have a lot of new products that are out there today, as are demonstrated in the exhibit hall. But again, there's not that new, really cool, tremendously advanced product that is going to make a major difference in wound care. We've got a lot of work to do to bring that forward so that we can take the next giant step in helping our patients. SAWC is by far the premier wound care society meeting in the country and probably the world. Having had the opportunity to attend a lot both here and around the world, I feel that you can come to this meeting and learn an awful lot about wound care. You can interact with the people who are making the products, who are creating the science that we're using to take care of our patients with wounds. And I feel that it is a tremendously good educational experience for anyone who is interested in wounds. Of course, you can't come and just slough off and sleep all day. But if you'll come, there are plenty of meetings. You will spend a lot of time doing this, and you will be very well rewarded for that.